Hello, my name is Dr. Anthony Talorico. Today what I'm going to be talking about is the cervical spine and additionally where certain problems occur and the symptoms that you're likely to experience. So what I've drawn up here is a lateral cervical spine, a picture from the side. So what I'm going to do is just get a marker here. I'm just going to talk a little bit about where some of the common problems are and the symptoms that you might experience. So this is going to be, for some people, a little shocking. But when we look at this top couple of segments of the spine, they do a lot of things that have to do with your head. So they affect things like having headaches, which would probably be your number one issue if you had problems in this area of the spine. I would say 80% of all headaches are related to this, okay? So if you're a person that has frequent headaches, this part of the spine is probably the culprit. Now, the other 20% are the other things, migraine phenomenon, allergies, stress, dehydration, all those other things. But the majority, the overwhelming majority, are related to the cervical spine. And in fact, in the literature, this is called cervicogenic headache. The other thing that occurs from this area is something called vertigo. Vertigo is like an uneasy, unbalanced feeling. It's very unpleasant to experience vertigo. And when patients have vertigo, they can have problems with their middle ear, or it could be problems with something more serious in the brain itself. And sometimes it's a spine problem. So some research going back even into the 1970s said that if there's pretty significant issues in the spine, some of the things that people experience, especially in this area of the spine, are headaches, ringing in the ears, sleep problems, and then fatigue. I want to throw in a couple of other things that occur, that symptoms that people experience with problems up here. And one of those is increased anxiety, and then vertigo, and balance problems. And the reason this is because the brain is constantly attempting to monitor its position, and it's doing so with what's called proprioception. That means, in Latin, it means from one zone. So the brain is constantly trying to monitor its position in three-dimensional space, and so there's these proprioceptive fibers that are always firing off and telling the brain where it's at, where your head is at, because that's really important for survival, okay? So if we have problems there, then more times than not, we're going to have some of these things or all of these things, okay? Now that's the upper cervical spine. That's C1, C2, and C3. Okay? And there's a lot of reasons for that. Some of that is blood flow, because the vertebral artery passes through the cervical spine and it supplies blood to the brain and to all the different things going on in the head. Also, now we're going to talk about the middle neck. And this is where we often see the first degenerative changes occur in somebody's spine. And the reason is that these spine can change shape due to trauma or injury or bad posture. And there's another video that I've put up called the 6 different types of cervical spine, and you should watch that video because I kind of go down each of those presentations and show you what's going on with them. So for this, see 4, 5, and into 6, cut that one in there. The problems here are usually pain and pain-related things such as arm pain, shoulder, and then the classic thing is the knot, where somebody says, "Hey doc, I have a knot on my shoulder blade. I'm hurting right back here. It's right here. I can get on it and I can push on it." And the reason that happens is these little joints in the back of the neck have a referral pain pattern down onto the shoulder blade, depending on which joint is involved. For example, the C3 and C4, they refer pain onto the upper back and trap, okay? So you could go and get all types of treatment for that area. You could get injections, you could get massage, you can get 10 different things on that area. You could work on those muscles, and that pain will never go away because the actual problem is in the neck, and it's due to these joints not working properly as they sit next to each other and they're supposed to move and glide across each other. And then the very, very low neck also has to do with the same things, and then it affects other things, like it can affect your upper back, your shoulders, your hands, sometimes your little fingers, all the different digits. And there's another problem that comes out of here, and it's called thoracic outlet syndrome, where the neurovascular bundle that comes through the side of the neck is compromised, and you get a lot of hand numbness, especially if you're working on something overhead, or you're driving for a long period of time, or you have your head back a lot. So depending on where the problems are, shows you what kind of symptoms you would expect. The overriding thing is, if you're having these types of symptoms, you need to have a good examination of the cervical spine, and definitely an x-ray, because the x-ray is going to help us really pinpoint what exactly is going on, and then what we can do about it. And we're going to treat each presentation slightly different. But the majority of folks that have these things, if we give them appropriate care, they get better. Now, like I said, there's a couple of different videos. There's going to be a video on headaches. There's going to be a video on the 6 different types of necks. I would advise you, if you have any of these things, to look through those and see which ones apply to you. And that'll help, because if you know what applies to you, you can be more of an advocate for yourself. You can make sure you get the best type of care, the most appropriate type of care. Just treating the symptoms is really not the answer. So if you have lots of headaches and you take headache medication over and over again and headaches keep coming back, there's a reason you're getting headaches. Maybe it's this. Maybe it's the other 20%. Or if you're having lots of problems with fatigue, or you have problems with your vertigo or balance. Also too, which I forgot to admit, this also comes through the mid-cervical spine, because there's some possibility that this will impinge on the nerves and affect some of the deep balance centers in the cervical cord. Okay? Well, once again, thank you for watching the videos. If you have comments, please leave them below. If you have questions, please leave them below, or contact me or contact my office. Thank you.